What could you do to protect your pets if you're sick or injured? My product, Save My Pet ID tag, helps you ensure that your beloved pets are safe and well cared for, even when life isn't what you expect.
He's on staff at two places on different coasts of Florida. We'll get into that. But at this time, let's give pause and applause to Dr. Mark Garny. Welcome to the show, Dr. Mark.
Thank you. It's great to be here.
Now, you have been practicing emergency veterinary medicine. You told me before we got on the air, for more than 2 decades. There's different specialties in the field of veterinary medicine. What is it that attracts you to emergency medicine?
I think being a little bit of an adrenaline junkie probably is paramount to succeed in this profession. You got to be willing to be flexible with your hours because, emergencies happen around the clock, as we all know. So,
and they typically happen at night, on weekends and holidays, and right before you go on a cruise. Am I correct?
Exactly.
Yeah.
Exactly. So you have to be willing to kind of do morning, noon, and nights. That's for sure.
I'm a master instructor in pet first aid, not on your level, but I've been doing it since 2011. And I work with a lot of ER and critical care veterinarians, internal, feline medicine, always learning, always a student, always a teacher. But I found sometimes in my classes, having a sense of humor and making everyone feel welcome and safe helps the brain be able to act in the real present moment because, we can kind of freak out as a pet parent. And I teach people, I give everyone in Pet First Aid for You permission to freak out later. So the good veterinarian is here, Mark Garny. What do you think about me helping people, how they breathe, how they approach their beloved pet that might be injured, and knowing that they can freak out after they've done the handoff to your team?
I think that's really important. I mean, you have to you have to be very empathetic with these folks that are coming in that are very stressed. And, my first boss in ER medicine over 2 decades ago taught me, he goes, you have 3 strikes against you before you even meet a client. It's like, 1, they're usually seeing you at a really rude hour of the night and they don't want to be there. 2, their pet is sick and they're very stressed out about it. And 3, they know it's going to cost a lot of money. So he goes, good luck trying to get over all those humps when you walk in a room to introduce yourself. So I think it's always important the way I kind of, explain cases in medicine to clients is how I would want that explained to me if I were on the other end of the room and didn't have, 25 years of medical knowledge and just trying to, simplify things and make sure that they understand, because it's confusing. You take a lot of things for granted, things that are very basic medicine to a lot of us that have been around the field or, anatomy and just pathophysiology in general.
Or even little medical jargon that you use every day. And we're like, that sounds like alphabet soup to me.
Right. Exactly. You'll have people from all walks of life that, some of them nod politely, but they have no idea to people that are in the medical profession, on the human side of things. And they really want that explanation to the nth degree of science. And those could be challenging clients as well, because sometimes they think they know more about medicine than you do. But, it's nice when people have at least a basic understanding. So it's important for them to know, what we're dealing with in that particular patient and what their options are. And when it gets to be a long shift and very draining as a professional is when you have extremely sick pets, with very serious conditions that are suffering. And clients are just either in denial or they're not allowing you to do what you need to do for that pet because oftentimes, financially you're restricted. Right. And, obviously we all get into this profession because we love animals and we are their ambassadors. That's
a good description. So what's a tip for compassion fatigue to prevent? What do you do? My sister was an ER nurse for 30 years and she just kept it all together during those crazy shifts. And then at home, she was able to give her permission to freak out. Maybe it's a shot of Fireball, maybe it's a cry in the shower, but you need to have that release, don't you?
Without it, I don't know how anyone could get through their career, to be honest with you. And we all have our own outlets on how we deal with that. I think, just having camaraderie in the profession and being able to talk to each other, because, we all lean on each other quite a bit and kind of, get through it going, yep, we're all in this together, and we all
camaraderie. Talking to a friend is a good outlet for you, Dr. Mark?
It is, but I also, the gym is a big outlet for me. Physical fitness.
And for those of you lucky to see this man, he has got some pipes. He was a former gymnast in college, and the man is kept in shape. We're not going to arm wrestle Dr. Mark Garny on this show. We have a great guest. His name is Dr. Mark Garny, and you can tell already the man loves to bring out the best in pets. He loves to help us pet parents understand things. The summer is coming, and there's a lot of different safety issues at bay. You live in Florida, Dr. Mark, and for folks in those kinds of climates, can you talk about the dangers of the bofo? Is that how you pronounce it, the toad?
The bufo toads, yeah.
Oh, let's hear that back, because I hear there's some very bad things that can happen.
Yeah, they're a big problem down here. I mean, every area has their own little regional problems, but yeah, the bufo toads down in the southeast here, they're an invasive species. They're the cane toads, and they secrete a neurotoxin along their back that absorbs very quickly through a pet's mucous membranes within seconds, and it causes severe neurologic problems in them. So owners oftentimes, they're scooping these guys up and bringing them in pretty quickly because they're so clinical, so fast. But, sometimes these guys are so severe when they don't make it to the clinic, depending on the dose of the toxin that they got from these toads. And it can be a small toad.
What could somebody do right there? The toad got their dog in before, and obviously calling ahead to alert you all that you're coming. But is there something we could do with water or a hose or do's and don'ts, just to help flush a little bit out while you're en route?
Exactly. That is the most important thing, is just to try to detoxify their mouth as quickly as you can, to rinse just with tap water, their gum line. If you can even take a wet washcloth and just wipe their gums down, keep re-wetting the washcloth.
Good.
Being careful not to stuff the garden hose down their throat, because these guys are prone to aspirating because they're not swallowing real well.
Yeah, that would not be good. I like the wet washcloth, because you don't want a heavy stream going down the throat.
Right. If you can somehow kind of irrigate the mouth with their nose pointed down so they're not as prone to aspirating, that's ideal. And then just getting them into your quickest veterinarian that's available for ongoing care. A lot of times these guys are going to need anticonvulsants, they're going to need GI protectants, they're going to need fluid therapy. Oftentimes they're coming in very hyperthermic already from all the muscular activity and convulsions they have, because dogs can't sweat like you and I can. They have to get rid of that core temperature with those big breaths. And when they're having seizure-like activity, they're not taking those deep breaths. And so they trap that heat very quickly. So we'll have these pets coming in 108, 110 degrees, and they're just burning up. And that causes metabolic acidosis pretty quickly, and it starts ticking off a lot of other organ systems in the body really rapidly.
So let's go into heat stroke. In my pet first aid classes, we try to teach people, look at the color of the gums. They don't lie. Gums can't bluff. And a pet getting overheated can have bright red gums. But as you mentioned, they don't have skin pores all over their body like us. They pant and their paw pads. What are some do's and don'ts for people? And when should they are on a walk with a dog saying, we need to go in the shade. We need to take a break. We need to go into the AC.
We have to remember these guys have fur coats on, 24/7, and they can't take them off. And so, being cognizant of what time of day you're walking these guys, and in areas like this in Florida, where it's not only hot, but it's extremely humid. And these guys just, they really shouldn't be taken out in the hottest parts of the day for walks regardless. Now, you also have breeds that are way more overrepresented to having problems. All the brachiocephalic breeds with the short noses.
Now, did you know, you probably know this, for 31 years, the Labrador Retriever has been the most popular breed by the American Kennel Club, but the French Bulldog is now number one. And I'm like, a French Bulldog with a pushed-in face living in Florida. Danger, Will Robinson.
Rarely a day goes by that we don't have 1 or 10 of them in the ER because of those kind of problems. So
really, wow.
And that's just where I just to Sarasota a couple of weeks ago, I actually came into shift with a French Bulldog that was only 2 years old, that never had a problem before in his life. And he was out at the dog park that morning, and it wasn't even hot yet. This was like 8 or 9 in the morning. So it wasn't peak heat yet. And he got overheated and came in unresponsive. And he actually arrested twice that morning.
Really?
And was able to get him back. And he ended up going home about 15, 16 hours later. It was remarkable because the owner was back in ICU with us and was like, my dog is dead. I can't believe this happened. He's 2, he's healthy. And he was fortunate.
We brought him back. So what should you do and what should you not do to get cool down a pet on the route to a vet? I understand ice, not nice, baby.
Well, and the reason why that is because, people are like, oh, we gotta get these guys in a bathtub of ice. And what unfortunately that does is it causes all their peripheral vessels to constrict, from the cold therapy. And that traps that internal heat, so now you're not getting rid of that problem internally. You're only cooling down the superficial layers. And so really it's cool therapy is okay. Some cool wraps are okay, but get them into emergency care because really they're going to have to be on room temperature IV fluids to start trying to cool them from the inside and restore their circulation.
Okay. And I understand it's good to dab on and off a cool towel, but don't wrap them totally because you might cause a sauna effect. Is that right?
Correct. Yeah. And like you said, the paws sometimes can help peripherally with getting rid of some of that. But really, it's medical care. Seek medical care is my best advice, when these guys are getting sick, because they can really spiral very quickly and it just causes more problems.
And we have cell phones with speaker. So I'm assuming you appreciate when someone's calling ahead to say their dogs yanked their nails off or they got bit by a toad, or you all like to know it's coming, right?
Ideally, it's nice because the staff's kind of prepared for that. But, I'd say over half of the emergencies that we have coming through the door are walk-ins that people are just flying in, screaming and holding pets that are having problems. And so you have to react. And I guess that's where that adrenaline junkie in me
kicks in. I'm so glad I got to meet you. I mean, you are why I love ER veterinarians. So let's talk about another scenario. Bees. Now, wasps are kind of nasty. Bees are just trying to do their job. But if your dog or cat got nailed by a bunch of bees or wasps and their throat is starting to close up, we've been taught in pet first aid to reach for diphenhydramine, Benadryl, but you're getting to the vet. You're just trying to keep the airway open. But do you have any tips on your pet just got nailed by a bunch of nasty wasps? What do we do? It's not just the one bite. It's a sting. It's a bunch. What do we do en route to the vet?
There's not a lot you're going to be able to do other than keep them in a cool, calm environment. Make sure they're not in humidity. They're not in heat. I wouldn't recommend trying to, get any oral medications down a pet that's having an anaphylactic response. And the shock organ in dogs is their GI tract. So when they're having a metabolic stress, they're releasing cortisol, stress hormone. It very exponentially affects their contractility of their intestine, and their stomachs bag out with gas. Their intestines become like an ileus, where things are just bagging out with gas and not contracting. And so when you give, people will say, how's my pet dehydrated? They're drinking all this water. Well, they have this inflamed GI tract. And even if they're not vomiting and diarrhea, it's just not being absorbed. And so you can I'll have animals come in with these hugely swollen faces from insect stings. And they're like, I gave him 4 or 6 Benadryl, and
it didn't work.
It's like, they're just not getting up to therapeutic levels because it's not leaving the GI tract. So you really need to bypass those routes with injectables. And the only way to do that is going to be at the clinic.
Okay, I appreciate that. What about a bad bleed? Something, and we tell people in our classes where the arteries are located. We don't teach how to do a tourniquet, but maybe put some pressure on the artery between the heart and the wound and watch the limbs. But what's your take on a bleed? Because it can look really nasty, but you need to stop the bleeding, especially arterial, because they could bleed out.
Yeah, I mean, certainly if they're spurting blood,
yeah,
you got to apply some pressure. If you can get anything, a towel, a t-shirt, something to compress that area. Fortunately, most animals that come in with bleeds, they have such a large capacity for splenic contraction to release more red blood cells. So it can look like a butcher shop, and these animals are still bouncing around, wagging their tail, and nice and pink in the gums. So they have a big capacity for that. But, it's really, if you do have something that's so actively bleeding, yes, of course, put pressure on it and seek emergency care.
Yeah, we call it GAP. Gravity's your guide, arteries are your allies, and pressure is your pal.
That's a good way to look at it, yes.
All right. Parting messages. I could talk to you all day, but what's a message you want to give folks as the summer approaches to help us keep our pets as safe as we can? And maybe as much as we would love to see you, Dr. Garny, not to see you.
I know it's always nice to see people, but I tell them not in the emergency room at 2 a.m, right?
Yeah.
I think, we're going to be outside more. The weather's getting nice. There's going to be parties and animals are going to be exposed to things. And, I think the bread and butter of the ER is the vomiting diarrhea dog. We have so many, every other thing is a vomiting diarrhea. And a lot of that could be avoided if we didn't kill these guys with kindness all the time by just giving them all these schnicky snacks and extra little bits. And I think sometimes folks forget that, when you have a 10 or 20 pound dog, those extra few calories is a big deal to them during the course of the day. That might not be as big of a deal to a 200 pound person, but when you're giving them an extra 30, 40, 50 calories, and these guys are starting to develop, obesity problems, diabetic issues, even just GI signs. Animals are so prone to pancreatitis, and it's because we're oftentimes giving them more calories than they need, and that pancreas gets a bit overstimulated, and those can cause life-threatening problems. And, so I certainly would say, try to keep those. I don't want, not to be able to love on your pet and things, but just
calorie-free hugs and kiss and is better than giving them something that can cause them to or.
It is. And for God's sakes, keep them away from the corn cobs.
Oh, yes, because they don't digest, and that's a bad thing. Yes, I agree. We're going to have you back because you're so awesome and you have a lot of good information. Everyone, I have been honored to have on our show today, Dr. Mark Garny. He has been practicing ER veterinary medicine for almost 25 years. Is that right? You look young. And he does it in both ends of the state of Florida, Sarasota and Palm Beach County. You can tell the guy is very, very dedicated. I appreciate you being on our show. You survived me, Dr. Mark.
Oh, you made it very easy. Thank you.
Thanks so much for making our tails wag by watching this guest interview from Arden Moore's Four-Legged Life. Four-Legged Life. Make sure to subscribe so you're up to date with all of our Four-Legged Life content. Four-Legged Life. Four-Legged Life.